Okay, hey Team Menace, nice to meet you. I'm gonna go ahead and do your interview today for your promotion. So I'm just gonna ask you several questions and then go ahead and answer them with your best answer, okay?
Okay.
All right, so give me one moment, okay?
Xavier?
All right, so I'm gonna go ahead and start asking you questions. The question number one: what are the main expectations of a green scrub while working in the hospital?
Okay, so basically, we're supposed to give the patients med kits and pills, selling them pills whenever they need pills.
Okay, awesome. And to just continue to learn hospital rules, keep practicing your micros, and of course, work underneath supervision.
Right.
Okay, question number two: why is it important for green scrubs to remain supervised?
Okay, so that's because we want to make sure that we're maintaining order when it comes to the hierarchy chain of command. We want to make sure that we are at least in line with a lot of things that need to happen just to reduce chaos.
Perfect. Perfect. And yeah, you're still learning, so you don't want to make any mistakes or get yourself in trouble. So like the best thing to do is just you know, work under their higher ranks for proper RP.
Right.
Okay, question number three. Who should you contact if you need help during a hospital scene?
And normally, if it depends on the situation. If it's a situation that I think a doctor is needed, I can contact a doctor. Um, if it's a case where we might have an escalation, I can reach out to the closest person, the closest authority that is there.
Perfect answer. All right, question number four. Why is proper micro usage important during medical RP?
Well, micros let the people around know exactly what's going on. Keep the environment informed of what you're doing, and if you might need help with the given situation.
Perfect. All right, yeah, like you said, you need to just keep structured and professional and clear during medical scenes. But great answer. Okay, question number five. Where are green scrubs allowed to sell med kits and pills?
Okay, so we have to stand behind the desk, most of the time inside the hospital.
Great answer. Yep, behind the front lobby desk. Okay, question number six. Why is learning hospital structure important at this level?
Well, at this level, you know it's a base level, so in order for you to be educated in how to proceed and how to grow within the hospital, you have to know how it is that we go ahead and operate on a level that would make you be able to matriculate easier.
Perfect. Great answer. Oh, right. Next question. What should you do if you see someone breaking hospital rules?
Okay, so normally would either take your recording of what's going on and use it as a report to report it to someone who's of higher authority than you.
Perfect. Great answer. And just make sure you don't handle it yourself because you don't want to get yourself in trouble or involved in a situation that, just protect yourself.
Here, Taylor Caitlin.
Oh, gosh. Okay. Let's see here. What skills have you learned that prepares you for white scrubs?
Okay, so I've learned to de-escalate situations. I've learned to talk to people and try to get them to understand the rules and procedures of how we operate. I've also learned how to better talk to my peers when it comes to communicating. Apart from that, I've also learned how to sell pills and administrate aid whenever it needs to be. I've done deliveries. I've also done emergency calls. I've learned how to estimate the distance so that I can get there as quick as possible whenever there's a medical call.
Awesome. Good answer. All right. When must your body cam be turned on?
At all times.
Perfect, especially responding to CPR calls.
All right.
All right. What happens if a medic uses a firearm while in the medical faction?
Radio check 10 for Devon. That is a dismissal.
Please use your correct macros for a radio check. It will be 10-4 copy.
I'm so sorry. Give me 1 second. They were talking through the walkie. Give me one moment, okay?
Okay.
No, no.
Unit 2 to Caitlin.
Yes, Addison?
Could you please come to floor 2 in the conference room, please?
Yes. What is this about?
Oh, okay. Oh, shoot. Sorry about that. I just wanted to go ahead and put in the chat really quick. It just took me longer than usual. Thank you for your patience.
Yeah, no problem.
Okay. Let's see. So yeah, the last question I believe you answered, but just go ahead and repeat it for me. What happens if a medic uses a firearm while in the medical faction?
Okay, so if you're in a medical faction, you're not allowed to use a firearm. It is strictly prohibited. That person would be dismissal.
Perfect. Yep, that's correct. And it's MD5 if you want to know, but that's the correct answer. So they get dismissed if they use a firearm.
Right.
What is the maximum pill limit per patient?
I believe it's
Yep, go ahead, go ahead.
15 to 30 pills.
Okay, so you're right at first. So it just depends on what the situation is. But let me go ahead and just say for the when you're in the ER lobby, how many do you pass out? What's the limit?
The limit that I use, 3 pills. I can only sell 3 pills at a time.
No, no, no. Actually, it's yeah, 3 pills at a time. But the amount is 6.
6 pills. Yeah. Oh, to one person.
Yeah, yeah, to one person. Like when they come through to the lobby asking for like a med kit and stuff, you can only give them 6 pills there.
Right. Okay.
All right. When are you allowed to refuse medical treatment?
I'm allowed to refuse it if the person is being rude or if they tell me that they don't want to be revived.
Um, well, when a patient is holding a gun, like holding out a gun, like so if you're in here, and they,
Oh, that's what you mean.
yeah, there.
Oh, I was talking about CPR. Oh yeah,
Oh,
I can't get that.
well, that's a perfect answer too for the CPR scenario. So that's a great answer.
Yeah, I can't give anyone or give anyone medical treatment once their gun is out.
Perfect, perfect. Okay, my last question. Can you demonstrate how to teach a green scrub how to do CPR?
Could you? Yeah. So once you're applying to the call and you locate the person, you'd have to take the revive kit and drag it to the person's body until it says use. You let it go, and your avatar will go ahead and do the CPR.
Perfect. Are you able to drop the first two micros right now?
Macros for CPR.
Yes, please.
I had a hard time trying to put it in. I'm not sure how to do the macros part. I was gonna ask for help with that.
Okay, so you haven't done the micros just yet?
No.
Okay. So before we proceed with your promotion, you have to go ahead and complete those micros first. So what I'm going to go ahead and do, I'm going to send you the on it's a new sheet that has the link that will break down everything for you. Okay, and then once you're done with that, you can go ahead and enter your micros because it's a breakdown on how to do it. It's really easy. It's a whole video, and then enter your micros, and then once you're done with that, we can go ahead and proceed with your interview.
Awesome. Okay. Thank
Okay,
you.
but you have done great so far. I'm gonna let you know you have done great so far. You've answered great with your questions, but until you get those proper micros in, I can't proceed with the promotion just yet.
Okay. All right. Are you
Okay.
gonna send them to
Yeah,
my
I'm gonna
Discord?
send. Yeah, I'm gonna send to your Discord. Give me a moment. I'm gonna do it right now while I have you here. Okay.
Okay.